MDNews Network recently attended the Medical Group Management Association's annual conference in New Orleans, where our cameras focused on attendees with opinions on everything from healthcare reform to healthcare technology. Here's what they had to say.
I think the importance of user interface can't be underestimated, and you're going to be hearing a lot in coming months and years about natural user interface, and that is I see the day coming when, although we may look back with some fondness on the mouse and the keyboard, that will become less important as other data input options and other ways of interacting with our machines comes to bear. Speech is getting much, much better. Touch and multi-touch now on even large screen monitors. Connectivity between small devices that we carry and basically with a flick being able to move it up to the large screen kind of environment where you touch and you move around and you interact with what's on screen much in the same way you interact with the physical world. And this will extend even to one of the clips I showed today, a 3D kind of environment basically that is taking surface computing and Windows Touch and multi-touch and moving it into a 3D experience in a whole room. Also, our display technologies are changing. We're going to be seeing very thin displays. I mean, so thin they can fold up basically or be rolled up. Lots of technological advances that are going to kind of change the way we interact with our computers. Connect in the home is another one of those, and Connect won't only be found in the home, it might be found in lots of places, and if not Connect, that kind of technology. So suddenly the device, the computer, sees us, it knows us, it can recognize our face, we can speak to it, it can offer up suggestions, it can help us with decision support. The next 10 years are going to be very, very interesting. And also I should mention the whole movement of software and services to the cloud. Our whole experience with the way software and services are delivered is going to change. The days of getting a shiny software on a disk are coming to an end. You'll be connected oftentimes with very light, very thin devices in a myriad of sizes that will connect to the cloud, and all of your software and services and even the computing power itself happens up in the cloud, either in a public cloud in a data center or in a private cloud that might exist in a government facility or in a hospital. As a physician, I mean, I fully understand how important the business model is and the revenue stream is in having physicians, or consumers for that matter, use technology. I often talk about the staff-modeled HMO, the Kaisers, the Group Healths, the Geisingers of the world, and how they've been able to create these amazing portals and web services for their patients because you have that perfect alignment between the business model, the payer, and the provider. They're one and the same. And when that's there, then there's every incentive to use this technology to not only increase access and satisfaction for your patients, but to start decreasing the cost of the impact of those patients on the physical plant and your staff and facilities. When you look at a group health and you say, wow, they've moved 30% of their primary care volume into virtual, that is amazing. I mean, think if across America, if 30% of the demand on our facilities was out in the virtual world, how that would change even what we mean by clinics and hospitals and how many beds and how many facilities we would really need. Many physicians today and practices around the country are hearing about the advent of the personal health record. There are services like Microsoft Health Vault and Google Health and some others out there. What I'd like physicians to understand about that is it's really the model that's most important rather than the particular entity that's offering it. And that is this concept of, instead of trying to hardwire to interconnect through HIE and NHIN, National Health Information Networks, RIOs, et cetera, the whole ecosystem of care, we aggregate data around the consumer themselves, and as that consumer moves through the ecosystem of care, their data moves with them. They are in control of the data. They share the data with whomever they want. That's their clinician, a nurse, a loved one, a family member, a grandparent, whatever. Gives the patient control. This is important for two reasons as I see it. One, technologically, it is the most feasible and least expensive way, especially as computing moves to the cloud, to solve some of the problems we have around connectivity between systems and keeping that sort of always available, truly transportable electronic health record. We can do it by aggregating around the consumer. From the hospital or clinic or physician's point of view, There's another advantage, and that is it gets back to business model. Many clinicians, many hospitals, many clinics, they don't really want to share their data with another hospital, with another doctor necessarily, or people feel it's their data. But almost everybody agrees that the patient about whom the data is about should at least have a copy of that data. So in this new model, I grant my patient a copy of their data, and that data aggregates around them and is stored in the cloud. And all the data from multiple providers is in that venue and around the cloud. And so as the patient moves through the ecosystem, the data moves with them. It actually gets us very close to the vision of the always available, truly transportable personal health record that we've been talking about for many years now. And I think it's the model that truly is going to take hold. Right now, it's slow going. It's the early adopters. We're now seeing services like Project Blue Button from Health and Human Services. So Medicare, VA, they can download their data and they can upload that data into the cloud, into their Google Health or Microsoft Health Vault account. That's the beginning of this transition we're going to go through as we start aggregating data around the consumer. I think we're at an inflection point, and I think that as people begin to look and study the model and its advantages over other ways of accomplishing this, doesn't mean that there won't be RIOs or HIEs by any means. But what it means is at the sort of the top level, a universal level, at the citizen-centric level, is the way we're going to solve that problem for consumers in having their information that's under their control and always available to them no matter where they are. Because even in the best systems today, and I'll cite group health again, great e-health environment, they use Epic, they use Epic MyChart, it's a beautiful thing. But as soon as the patient walks across the street someplace else, it's all for naught. If that data is aggregated and lives with the patient under their control in the cloud, it travels with them no matter where they go. That's the advantage. I could answer a question about what we're working on several levels. First of all, there's sort of the core infrastructure conversation we could have, which is about moving things to the cloud, which is going to help commoditize cost. It's going to help us around lots of things around updating software and updating services. It's going to let people buy just the amount that they need and scale up from a few users to millions of users. Those are all advantages of the cloud. The other thing that I'm a real fan of is tools around communication collaboration, because communication and collaboration amongst care teams, between care teams and their patients, is one of the fundamental, often dissatisfiers that patients experience. It's one of the areas where we see breakdowns in communications that cause medical errors. So you're going to see a whole host of tools, again at commodity pricing, that really extend the range of the ways that we communicate and collaborate. Again, infrastructure that allows us to know who's available, how they want to be contacted, the ability to move from an instant message to an email to a video conference to a full-blown web conference with just a couple of clicks of the mouse or perhaps an audio command. And even our telephony is all being voice over IP, so it's really changing the way we communicate and collaborate. The third area that's critically important is around business intelligence, or what I like to call patient intelligence, and that is, Malcolm Gladwell talked about, you can just, there's a tsunami of data coming at us. How do we get a handle on it? How do we use powerful tools to aggregate it and analyze it and serve up exactly what we need to know when we need to know it? And how do we automate some of that so that actually the machine in the background, and machine learning and artificial intelligence is kind of mining through that and only bringing to our attention that which is really, really crucial and needs a decision. And also, when we need a decision, software that helps us do that. Whether this is looking at dashboards, whether it's looking at key performance indicators, or whether it's looking at technology such as we have with Microsoft Amalga, where we create basically a layer that kind of sucks up all of the data in an enterprise and then serves it up to end users who, by the way, don't have to be data geeks in order to use these tools. That's when we've really accomplished something.
Now that you've heard what the MGMA conference attendees have to say, we want to know what you think. Click on Share Your Perspective at mdnews.com to let us know.